I'm Marcy Fraser. Parkinson's disease is a movement disorder, and over the last 3 decades, the treatment options were limited until now. The symptoms of Parkinson's disease include tremors. Medication is used, but long-term can make the tremors worse. Diagnosing Parkinson's can be done with a brain scan, which measures the level of dopamine.
When people become symptomatic with Parkinson's, dopamine levels are about 80% reduced.
After medications are no longer effective, some patients are candidates for brain surgery, where a deep brain stimulator is implanted.
Make a small hole in the brain about the size of a nickel, open up the covering of the brain. We use a special microelectrode tip, which is the finest thread in diameter.
The microelectrode is then fed deep through the brain to the area which, when stimulated, stops tremors. When performing surgery on the brain, we know you need a steady hand, and in this surgery, you need a good ear. As she passes the electrode through neurons within the brain, it causes friction, which creates a sound like this.
We listen to what those neurons sound like. What we're looking for when we say we got it is when we move the patient's arm or leg, and you can hear a difference in the firing pattern of that individual neuron.
The frequency sounds are distinctly different in various parts of the brain. Just listen. And here's another section of the brain.
Everybody in the operating room can hear what we're doing. We have the microelectrode, which is in the patient's brain, connected to an amplifier and a system where we can actually see what the neurons' recordings look like and hear them.
Once the stimulator is implanted, a separate device similar to a pacemaker is placed in the patient's upper chest area. Most patients see a 50 to 80% reduction in their disease.
And, they're able to come off their medication by almost half. People wonder why they didn't have it done sooner.
For Healthy Living, I'm Marcy Fraser.